Good afternoon and welcome to Praxis Peace Institute's Friday Forum. I'm Georgia Kelly, the director of Praxis. Today we have a special public interest program for those interested in healthcare in California, which should be all of us. Mary McDevitt, MD, completed her medical training at Mount Zion Hospital in San Francisco, and after 14 years of practice in internal medicine and pulmonary disease, she became the medical director of San Jose Medical Center. And in 1995, she assumed the position of medical director of Marin General Hospital. And since retirement, she has lived in Sonoma and shared her wisdom with all of us. So thank you, Mary, for joining us today and giving us this much needed program. So I'll turn it over to you.
Okay, thank you, Georgia. Can everybody hear me? I hope.
Yes.
Okay, certainly this big budget bill has, let's see, Georgia, you might have to help me. I don't know how to make the screen go to the next slide. Does anybody know that?
I don't know that I can do that from here. You can just, the little arrow down at the bottom, just move that. It should change it.
Yeah, let me see if I can. God, that one didn't work.
You can scroll your mouse down if you're using a mouse.
I'm using the mouse, Kathleen. Can you see it here on the screen? But there's nothing on the bottom that
On your
lets me go to the
keyboard,
next slide.
Mary,
It's on your keyboard.
on your keyboard, Mary, go down to
Yeah.
the bottom where those arrows are, and you should
Yes.
be able to punch one of those arrows, and the next one will come up. There we
How
go.
about that?
Yeah.
Okay. Thank you very much. I'm just not competent when they change these programs around on me. Okay, a late start, but I thought we would start off by just reviewing what the healthcare programs that are presently affecting all Americans. And certainly most people are familiar with the Medicare program. It has a Part A,
Mary,
which covers your, yes.
you need to stay stationary right in front of the speaker because your volume is going in and out. Yeah, stay right in
Okay.
front of the speaker. Great.
Okay, thank you, George. Is this better now?
Yes.
Can you hear me? Okay, as I said, we're probably all familiar or most familiar with Medicare. It has both Part A, which covers mainly hospital, and Part B, doctor and outpatient services. And then Medicaid is the federal program for people that can't afford regular insurance. And that is funded by both federal funds and also the state funding. And that was implemented in 1965, as you can see on the slide here. Part C is Medicare Advantage, and this is where the private insurance companies got back into healthcare in the United States. That was implemented in 1999. And then Part D, which came in 2006, was providing drug coverage. And again, this was through private insurance. Now, the Affordable Care Act, you might all be familiar with this as well. It's known as Obamacare. And it came into effect. I can't see the date because Georgia is there. But it made affordable insurance available to more people. That was the main purpose of it. And also, one of the big things that it did was prevent insurance companies from penalizing you or refusing to give you healthcare insurance if you had what they call a prior existing condition. So if you had diabetes and you wanted to apply for insurance, a lot of times you would have to pay extra, or some insurance companies might even refuse to insure you. This was done away by the Affordable Care Act. Now, this act provided for states to expand their Medicaid programs. This happened in 2014. And in California, 5 million people became eligible for health insurance under the Affordable Care Act. And it was initially for people that were under 65, therefore they couldn't get Medicare. They had no dependents and they were higher income than the people that had low income and were eligible for Medi-Cal. Now, here's the some just figures on the population. Certainly, the state of California, some of you may know, has a almost 40 million population. In 2024, 10,900,000 of those were foreign born. That doesn't mean they weren't citizens, but they were foreign born and now residents of California. The number on Medi-Cal in 2025, as you see, there was 5 million people. The number on Medicare, 6.6. And in Sonoma, where our population is 494,000 people, the number on Medi-Cal was 143,432. In Sonoma County, we have 1,500 plus physicians, and physicians taking care of this Medi-Cal population are 298. Now, I'm bringing up this gentleman because he now is in charge of the Office of Budget and Management. I'm sure you've all heard his name. He's a big Trump supporter. And in that position, he issues policies that affect the 2 million federal employees. And he has the responsibility of dispensing $7 trillion in funds that have been appropriated by Congress every year. He has eliminated USAID, which was only 0.3% of federal spending. And this program, it was in the news several months ago when the elimination was noted. And essentially, it's what our government gives federal aid to programs in other countries. So that has been wiped out. He also tried to eliminate the Consumer Financial Protection Agency, which since its founding, which was in, I believe, 2010, it was originally founded after the 2008 financial crisis. And they wanted to put an agency that would protect consumers that enter into financial arrangements with banks and other entities. And since it was established, it has saved consumers $19.7 billion. And a lot of this is a return to the consumers that have been injured by some of these projects. I was a little disturbed in looking at this history to find that one of the organizations that had been investigated was my bank, Wells Fargo. So I did a little research on that. And what had happened, Wells Fargo was pushing its employees to open more and more accounts. And what they were doing was opening accounts to meet the numbers that they were required to do, but they were doing it taking money from accounts that Wells Fargo customers already had and opening up new accounts so that they could claim they were starting new accounts. Because of this and the investigation, luckily this was way back in 2016, and the Wells Fargo Bank had to pay multiple millions of dollars in fines. So that's essentially what this organization did. It protects any financial transactions that Americans might be involved in. Okay. Now the other one that I don't know if you have heard of, it's just the last one on this slide, was that he has also eliminated the Institute for Peace. Now, one of the things also that's been affected by the big, beautiful bill is the SNAP program, which you might have heard there was a lot in the local news when that was eliminated in the big, beautiful bill. But it's the Supplemental Nutrition Assistance Program, and it's been around since 1961. It was started by President Kennedy. And there are 42 million Americans that depend on this program to put food on their table. And the beautiful bill cut $186 billion from their funding. It was revealed that the program did have this contingency fund of $6 billion that could be used, but our president said it would not be used for providing food under this program. So there'll be no benefits under SNAP to these 42 million Americans that depend on it as of November 1st. And the program does represent 8% of all food that is bought through this program. So it's financing a lot of local economies. Okay, let's get into some healthcare things here. As you probably know, Robert Kennedy Jr. is the Secretary for Health and Human Services. And you probably heard enough about his feeling that vaccines are dangerous. And I think he still believes that a vaccine will cause autism, although medical research and multiple papers have shown that this is not true. But I just wanted to walk you through the history of the measles vaccine, which you can see here. It was developed in 63, and then it was combined with the mumps and rubella. So it was then the MMR vaccine that children got when they were very young. And then the chickenpox vaccine was developed in 95 and it was added. So now children get the MMRV, which is really a vaccine against these four childhood infectious diseases. And in the year 2000, it was considered that measles was eliminated in the US. That doesn't mean there was no cases. It could have been brought into the US, but it certainly was not spreading with multiple cases throughout the country. And as you can imagine, everybody was very proud of this designation. So, since our Secretary of Health and Human Services is not fond of vaccines, he has changed the recommendation. And in 2024, you can see there were 285 documented measles cases. You can see the numbers for 2025 with 3 deaths. And what I was able to get for just the first 2 months of 2026, there have been 1,136 documented cases. So I don't think our secretary is really helping the American population. Okay, now another big issue regarding healthcare in this budget reconciliation bill is its effect on Medi-Cal. So they, through the bill, they, have different lines, but it has been estimated that over 10 years, this budget will have reduced $1 trillion over the 10 years from the Medi-Cal program. And as you can see there, in October of 26, that people will no longer be eligible for Medi-Cal. This is one of the ways they're reducing it. And even for emergency care, Medi-Cal will not be paying for immigrants. Now, refugees, asylum, trafficking survivors all used to be eligible automatically under humanitarian grounds, but they will no longer be eligible. And as of January of next year, all adults applying for Medi-Cal must prove that they are working, looking for work, or participating in job training. Now, I've seen reports that most people on Medi-Cal that are working, but this is requiring development of whole new data systems to record this, and also data systems that now will document twice a year when people have to come in to check their eligibility instead of what is done right at present, which is once a year to check that. So in California, it's estimated that 400,000 people would lose their coverage. And the last thing under Medi-Cal program, the changes that they now, doctor visits, they will have to pay a copay up to, I think, $35 is the figure I've seen to visit a physician. Now, Medicare has less important change, not important, I would say, but they don't add up to the numbers of the changes financially in the Medi-Cal program. So under Medicare, in January of next year, the immigrants who have paid into Medicare, since they are working, it's taken out automatically, they'll no longer be eligible. And I've been told that this is the first time that people have paid into a national program that now they do not get the benefits from it. So, and they have approved certain immigrants to get into Medicare. So obviously, if you're a citizen or you have your green card, or you're one of these COFA migrants. And that comes specifically from an act that was passed in 1985 that concerned the Marshall Islands and Micronesia. Or if you're an immigrant from Cuba and Haiti, then you would be approved for Medicare. In October of 2034, as you see there, this is kind of funny to see a provision regarding nursing homes. But a lot of times with, as I understand our federal government, if they have issues that they can sneak into other bills, they do that. So there is a provision in this bill that's really concerning Medicare, but they do have this one item related to nursing homes. So it will not be enforced, which is a staffing requirement for nursing homes until October of 2034. So if you can, if you think you're going to need to go into a nursing home, please don't do it until 2034. And then, as I mentioned, there is special treatment for these immigrants from Marshall Islands and Micronesia. Now, this is the effect on the ACA or Obamacare. And presently, since Obamacare or the Affordable Care Act was implemented, it covers 7% of the United States population. And you've heard a lot in the news of argument over subsidies. Well, the subsidies they are talking about are the federal monies to support the Affordable Care Act. And those subsidies have been in place, as you see here, since 2021. And because of the subsidies, people could now afford to pay the premiums for the Affordable Care Act. And there was a surge in enrollment. And interestingly, 88% of this increased enrollment occurred in the states that Trump won in 2024. So I think there may be a lot of unhappy people in those states related to these changes. So the bill says that the federal subsidies for the Affordable Care Act have ended in January of 2026, and 24 million would see increases in their premiums. And this is an example that I was able to find recently. So if your premium for your Affordable Care Act in 2025 was $888, your 2026 premium would go up to $1,904. Quite an increase. So they estimate 90% of all the people that are involved with the Affordable Care Act, all these recipients will be affected. Hospitals. Well, in the big, beautiful bill, there is sort of a sub-bill that is called the Rural Health Transformation Program. And it has estimated that the cuts to the hospitals of $321 billion over 10 years, these are for rural hospitals, and that this program, to balance that, $321 billion will provide $50 billion. It only provides money for 5 years to the state, so it's very limited. And it only allocates this $50 billion as it's broken down to approved states. I couldn't find out how a state gets approved, but you can guess how that might happen. Now, the American Hospital Association has evaluated this Rural Health Transformation Program and the $50 billion. And they estimate that 300 hospitals will close because their funding will be insufficient because of this big, beautiful bill. Now, I did take a look here for the financials of our Sonoma Valley Hospital. As you can see there on the left, I have the numbers for Medicare, Medi-Cal, which is the Medicaid program in the state of California, and then commercial insurance and other. Now, other might be if, you're a vet and you have veterans for your health care, or perhaps you're a Kaiser patient, you're coming into the hospital. I'm not sure if Kaiser would be under other or commercial. But anyway, as you can see, the Medicare is relatively stable. It's come down a little. But Medi-Cal has really increased from originally 21.6% in 2023, and last year it was 31%. Now, the problem with that number, even though it has gone up, with the cut of funding to Medi-Cal, people are still going to come to our hospital, but the Medi-Cal funding will be cut. So I think it is going to affect the financial stability of our hospital. And for any of you who maybe are thinking about enrolling in Medicare or at that close to age 65, there are several enrollment periods. You can start or enroll for 3 months before your 65th birthday or 3 months after your 65th birthday. And that is the recommended time to enroll. But if you don't, then there is a general enrollment period, and it starts January 1st and ends March 31st of this year. So you can sign up for Part A and Part B if you did not sign up when the restriction time frame of 3 months before your 65th birthday, and I believe it's 3 months afterwards. Now, if you don't sign up right away, there are some penalties. If you do not sign up for the Medicare Part A, which, if you remember, mainly covers your hospital costs, there'll be a 10% increase in your monthly premium. And it would be that 10% increase for twice the number of years that you delayed in signing up for Medicare. Now, for Part B, which is outpatient services and doctor fees, if you sign up late, there is, again, a penalty, which would be 10% to your monthly premium, would be increased. And that would last as long as you have Part B. So if you do get into Medicare, you're going to be paying that penalty probably for as long as you live. Now, the Part D, which, if you remember, is the pharmaceutical part for your medications, it also has a penalty if you don't sign up right away. The penalty, again, is 1% of what they call the National Base Beneficiary Premium. And I'm not quite sure how they determine that, but for last year, that would be $36.78. So that would be added to your premium, your monthly premium for Medicare Part D. Now, there are a few examples that you won't have to pay that Part D premium if you're retired, you're over 65, but you still get coverage through your job or your spouse's job, then you wouldn't have to pay this penalty. Or if you work for a company that provides healthcare insurance even after you retire for a certain period and then they drop it, then you wouldn't have to pay the penalty when you apply. Or if you get your coverage through the VA, then you would, and want to apply for this, you wouldn't be penalized. Okay, if you are thinking or in looking at or coming near to consideration of Medicare, if you call this Medicare number, they will tell you exactly what programs sponsored by what insurance or what Kaiser. I believe Kaiser has 2 different programs available in Sonoma. But if you go with one of the Medicare Advantage programs, I would urge you to be sure that you get enough information about the program so you know what you're getting into. So be sure that you get the list of the hospitals that are in the program that is being offered and that you're interested in. And also, if you are now seeing a physician, be sure that the list of physicians in the network that the particular program covers, that your physician is there. Now, a lot of these Medicare Advantage programs are being taken to court because a lot of these lists turn out not to be true, that there'll be doctors on there that are really not part of the program. So I would just urge you to be very careful if you're ready to consider joining one of these Medicare Advantage programs. I would also ask you to consider that the Medicare Advantage programs are run by for-profit insurance companies. And there's been a lot of problems with getting in to see physicians. And also, there's been a lot in the papers recently about prior authorization. Some of these companies require your doctor to call and get prior authorization before the insurance company will pay for procedures that your doctor feels are medically appropriate for you. In fact, they have denied payment for some issues. And this is one of the reasons that physicians are really getting so unhappy with the practice of medicine, because not only do they have to practice medicine, they have to run a business, but they have to run a business where their medical determinations are being questioned, and they have to justify them to non-physicians in insurance programs. So I've been looking at the numbers of people that are going into medical schools, and it has not decreased significantly yet, but a lot of articles are written interviewing doctors, and most of them are saying they would not recommend that their children go into medicine at this point in time. So this is just a little summary. I know I've covered a lot, but just to give you an idea what this wonderful, big, beautiful bill is doing to healthcare in California and in Sonoma. But please remember, it's affecting every state in this United States. So, Georgia, if you want, maybe I could take some questions if anybody has anything they'd like to ask.
Right, yes. When I call on you, you can unmute. I'm going to let a few more people in that actually were late, so they weren't let in the middle of the program. But yes, if you'd like to ask a question, please let me know or put your hand up or put it up with the automatic thing. I'm going to look and see if there are any people before I send this other email out. Okay, I don't see anybody ask.
Okay.
Beth, you must have something. Alana, okay, I see. Alana, go ahead.
Hi, Mary. Good to see you. It's been a while since Mondragon.
Yes, it has.
Question for you. I understand in general Medicare Advantage, but when you look at a Medicare PPO, do you have any comments about that as opposed to just a regular Medicare Advantage? I actually have a PPO, and I
Yeah.
have to say I've been happy with it. So I'm curious.
Is that here in Sonoma,
It
the
is.
program that you're in? And who runs it?
It's Blue Cross.
Oh, it is a Blue Cross.
Yeah.
Okay, I'm really not that familiar with any of the private programs here. All I know is that they're all very competitive. They try and give you the smallest, monthly premium, but then they increase what you have to pay out of pocket, before the insurance will cut in. Do you know with your program how much you have to spend before your insurance will cut in or no?
Well, this is one of those, what did you call it? Credible. It's through my husband's retirement.
Oh, I see. Okay.
So
Yeah,
it's
that
it's a big
they
pool.
might be a little better since they have big companies that are sponsoring them. But preferred provider usually means that there is a network that you are restricted by the places you can go and the doctors that will take care of you. That's usually what it means. So I'm not quite sure without seeing your program and looking at what the restrictions are. But you're happy with it, is that
Yeah,
right?
so far it's been great. The co-pays
Okay.
are minimal, and I've seen pretty much everybody I want to see. So
Okay. Well, I'm very happy for you. Very good.
thanks.
All right, I see Beth has her hand up. Do you want to go ahead, Beth?
Yeah, a couple of things. First thing, a suggestion, maybe you want to take the slide down so we could all see each other more.
I was thinking of that, but I'm afraid I'll hit the wrong thing.
Well,
Can
I'm going to
somebody
stop
tell me?
sharing. I'll stop sharing.
Okay, if you stop, then it'll go down. Okay, good.
And then I have a supplemental plan through my work, my former work. I'm retired with Blue Shield. I don't think it's an advantage plan, though. I think it's a supplemental. Mary, do you know that if there's like if there are such things that are different?
Yes, I think there are, Beth, and I think what it is, you probably have regular Medicare, and then, Medicare only pays 80% of, say, your hospital charge. So everyone who's in regular Medicare has to have a supplemental insurance to take care of the 20%. So I think that's probably where you are. That I have regular Medicare as well with the supplemental insurance through United Healthcare. And every year that monthly premium keeps going up and up and up. Luckily, I can afford it, but I'm sure a lot of people are not able to pay for the supplemental insurance. But I'm pretty sure that's what you have, Beth.
I think you're right. That sounds the same as mine. I pay a pretty big copay for that supplemental, but then I can go to any doctor I want, and I've never paid a copay at the doctor's or at the hospital. I mean, I've had major surgery and didn't have to pay anything extra for that, so that was good.
Yeah.
And
Well,
one more,
yeah, but that is the advantage that I maybe didn't mention at the beginning. If you get regular Medicare, you do have to get a supplemental policy to cover the 20% that Medicare does not pay, but you have absolutely no restrictions on what hospitals you can go to or what doctors you can go to. And when I had to make the decision, I wanted that freedom to be able to go where maybe a super specialist was if I had a condition that wasn't very common, and be able to do that without penalty. So I think that is the advantage of regular or traditional Medicare if you can afford the premiums of the supplemental insurance to pay the other 20%.
right. And one more quick thing. Mary and I went to the Democratic convention a couple of weeks ago, and we were handing out leaflets about single payer for California. And I was wondering if you want, and that's coming up this year. We're very excited about it. There is a bill that will be proposed again that will maybe get single payer health care for California. So do you want to say something about that, Mary?
Well, it's the California nurses. It's, I think, the same program that they had recommended several years ago, which really didn't get anywhere. So they are trying again. I would love to see California be the first state to have a single payer healthcare program. I haven't really heard a lot about the support for it. I am going to some events over the next couple of weeks. I'm not quite sure how soon it comes up for vote. I think it was introduced into the our local. I'm not sure if it started. Do you know, Beth, if it started in the Senate or in our assembly in California?
Well, Ro Khanna is one of the sponsors. So is that,
Right. Yeah.
I think that's Assembly.
Yeah. Okay.
Yeah.
All right. Well, it is introduced, and I would hope everybody will look into it and support it because it would be wonderful for the people of California if we could have a single payer healthcare system.
I think one very important part of this single payer getting traction in California is who the next governor will be, because both Jerry Brown and Governor Newsom refused to actually get involved in having single payer in California. But there are people running right now who support it and would support the legislature and would sign the bill. And that includes, and correct me if you've got more people, pretty sure that Katie Porter is for it. Tom Steyer is for it, and Barcera is also for it. I don't know that anyone else who's running supports it. Those three do. And I think Becerra probably has less of a chance of getting elected than Steyer or Katie Porter, who seems to be at the top of the list right now.
Yeah, I think you're right. I think those are the three that are supporting it in California. But it would be, wonderful. And everybody said, oh, well, it's going to be so complicated. Well, if you look at Canada, it was only one province that started it, and then it spread to the rest of Canada. So, there'd be a lot against it because these insurance companies are making billions selling healthcare insurance and denying care and not paying. So I would hope that California would be able to adopt a program. I'll have to do a little more research to see where that is right now, though, Georgia.
Yeah, I think the candidates supporting it, I think it's really important to get behind and support those candidates and let people know that the other candidates do not support it. So if they're
Yeah.
vacillating between one or the other, they can see what's more important.
One more quick comment. So some of you probably know that I'm with the Sonoma Valley Democrats, and so is Mary. So if you want to know more about healthcare for all, at our meeting on March 23rd, we're going to have a speaker about that. And I put how to contact me if you don't already get emails from me about it in the chat.
Great. Okay. Do we have more questions, comments from anybody? Got a hand clapping. That's nice.
Kathleen has her hand up there.
Okay, go ahead, Kathleen.
Hi, I'm Kathleen Healy. I'm a friend of Mary's, and we're both members of Physicians for a National Health Program. And I just wanted to add to Mary's wonderful discussion. I attended a Zoom that was presented by some of the state medical providers on the impact of this bill that she discussed on our state. And we have a lot of community health centers that are federally and state funded. And the federal requirements are that they see and treat everyone regardless of their insurance or ability to pay. So primarily, Medi-Cal has been supporting these community health centers. But now with the cutbacks, they're going to have the same mandate, but with much less funding. And so it's really unclear how their services are going to be cut, or if the state will be able to provide the difference. I doubt it with their budget, but that's a real concern. And the other concern is how it impacted Planned Parenthood. And I think about 5 of our Northern California Planned Parenthood clinics have closed after that bill was passed. So it's having a terrible effect on California.
Yeah, Kathleen, I'd just like to add to that. When people do lose their Medi-Cal or those clinics close, then the local hospital emergency rooms are going to turn out to be the site of care because a hospital cannot turn away anybody. They have to see them when they come to the emergency room. So it would be another big stress on the rural hospitals with more people coming that have no ability to pay for the services.
Definitely. And as you mentioned on your slides, Mary, they're cutting back emergency care too, because typically if someone came to the emergency room with no insurance, they could get emergency Medi-Cal coverage for that. But if they start cutting back those funds, then the hospital will have no way of getting reimbursed for that care.
That's correct. Yeah, it's going to be bad.
Yeah.
I see that Moira has her hand up. I haven't been able to get rid of this screen. I'm not sure.
I think Mary has to do that.
Yeah, that's what I thought too. It's something I can't do from here.
Mary, you can do stop share of your screen.
And let me see, where is that?
Go to the bottom of your screen where it says share. See that little?
Well, now everything's up on the top. It says
it's either the bottom or the top.
Wherever it says share, you just want to click on that and unshare.
Or stop share. Yeah.
Well, I'll tell you, it says resume share. And I don't see any way to, well, how about if I just close this? Would that,
there we
go.
That worked.
Excellent.
Okay.
You did it.
All right,
Thanks for
Moira.
all your help. I'm telling you, I feel so incompetent here.
Well, next time we do anything with you, Mary, we're going to have a practice session first.
I think that's very well advised.
Right. Okay, so Moira, you have a question? Go ahead. Moira, where did you go?
She's muted.
Oh, are you muted? Moira, you need to unmute wherever you are.
I can see her, but she's muted.
Yeah, Moira, we can't hear you. You're mute.
The little microphone maybe on the bottom.
Well, if there's anyone else who has a question.
She got it.
Oh, she got it. Okay, go ahead, Moira.
He was working on the wrong one. Mary, the vaccine situation bothers me terribly. And I have memories when I was young of a situation where an in utero fetus of a woman who's exposed to measles was in danger of birth defects. Am I misremembering or
I really don't have the background to comment on that, Moira. I'm sorry. Certainly, if a pregnant woman gets infected with the virus, I think it's perfectly possible that the fetus would be affected too.
Yeah.
But I don't really have any personal knowledge about that.
I think that was rubella, the
oh,
German
Was it
measles.
rubella?
They called it German measles. Yeah, rubella was associated
okay.
with birth defects.
yeah,
Thank you, Kathleen.
Sure.
yeah,
A long time ago.
the dialogue with all the other misinformation. Yeah. All right. Thanks, Mary. And thanks so much for your program. It's fantastic.
Oh, you're very welcome. My pleasure.
Yeah, I'm going to go through it all again. So any other questions or comments? I don't know how much people are paying now that this has all changed, but I know being with Kaiser, I'm paying less than anyone else I know. Even though it went up this year, I'm still paying less than $100 a month for my coverage.
Oh.
Just for you to know.
Yeah,
if you want to switch, you have
all
until
my
the end of the
friends
month.
that have Kaiser, they're very pleased with it, except for some subspecialties where they have to, travel a bit to see somebody. But otherwise, the premiums are low. I think it's
Yeah.
wonderful.
I'm happy. So, and I'm about to have knee surgery. No fun. Mary Flatt, you have your hand up. Do you want to go ahead?
Yeah, I just want to put a plug in. Thank you, Mary, for this wonderful presentation. I'm a behavioral health provider, and oftentimes when we think about Medicare coverage, we think of it purely in the physical care realm. One of the challenges is finding healthcare providers in the behavioral health realm that take Medicare. And if you are experiencing what is oftentimes concurrent episodes of anxiety or depression, you'll be treated by your primary care physician, but would benefit from seeing an additional either therapist or psychiatrist. That is much more challenging, not because of the coverage, but mostly because there are fewer providers. So I just wanted to give a heads up around that and encourage people to remember that things above the neck also need to be treated.
Mm-hmm. Thank you for that.
Thank you very much. Yeah, thanks, Mary.
Anything else? We have a few more minutes if you have more questions or comments or information that might be helpful for all of us to have. This would be the time to bring it up. Looks like everyone's quiet now. Some people just came in and missed the program, and a lot of people signed up and didn't show up. So they'll get the link to it later tonight. I'll send the link out to everyone. I'm not sure I'm going to take the time to edit out all the instruction for you, Mary.
That's okay. I'm sorry I was so bad. But I can't stand it when they change things. I feel I know something and then all of a sudden there's an update and forget it. It's like you have to start all over again.
Well, things show up in different places on the screen.
Right, exactly. Yeah.
I know that. Okay, it looks like we may not have anything else. No, I just feel like there is something else and I don't know what it is. Do you have a sense, Mary?
No.
No. Okay. Then maybe we're done. This has
Okay,
been,
well, thanks, everybody.
thank you. This has been really good, Mary. I think everyone's gotten a lot from it. And just one more reminder, if anyone wants to change providers for that extra 20%, you have until the end of this month to do so. So
Very good. Okay,
thank you,
bye,
Mary.
everybody.
Bye.